In 2015, despite all the advances that we have in medicine today, African Americans die disproportionately compared to whites just because they don't receive the same health care as whites. That's especially true in Buffalo, especially those who live in 5 zip codes within the Buffalo area. Their premature death rate is 300% higher compared to whites.
One of the social determinants of health is race, and that should not be. That we should be able to eliminate race as a factor in the quality of health of people. The data is showing us that African Americans are more likely to die of certain diseases than whites, have certain diseases than whites, be in a situation where their health is at risk, have access to quality, affordable health care than whites. Birth outcomes for women, worse for black women than it is for white women. Pediatric black children are sicker than white children, and it goes on and on and on.
Nationally, this means that there's 83,000 additional black deaths per year just because they're not treated equally as whites in the healthcare system. That adds to over $220 billion a year excess costs to the healthcare system.
I want to find ways to prevent our people from getting hypertension, from getting diabetes, from getting heart disease. You know, we're so quick to let somebody get sick, hospitalize them, and then start plying them up with all these drugs, when we can do some things to develop a robust prevention initiatives.
Buffalo has the ability and the opportunity to fix this problem. We have a nationally recognized cancer center. We have a school of public health. We have a medical school. But it appears that we do not have any collaborative strategic plan to assure that we eliminate this problem in Buffalo.
We have this great big medical corridor built that actually towers and hovers over the African American community, and yet I haven't heard a lot of conversation about the kind of research and the kind of work that needs to be done to try to eliminate some of these health disparities.
This problem occurs due to what can be considered just outright neglect or an afterthought. The healthcare system has been designed to appeal to and to cater to the middle class and the wealthy, then to cater to those who may need them the most, and that's usually the poor and disenfranchised. The system has sort of been designed that way, starting from the beginning of the healthcare system. And especially due to historical reasons in America, blacks started off behind from a healthcare perspective.
There's a probability that I would live 8 to 10 years less than my white colleagues, just based on race. And so what we're saying is I want my 8 to 10 years back. You know, I don't feel like the fact that your race should be a social determinant to your quality of life and now even how long that you live. And I think there's things that we can do around research, around some other things that can address and tackle these problems.
So if we don't collectively come together and think of and work together and utilize the resources appropriately, we will never end this problem. And our great-grandchildren will be still suffering from this. The reason this affects all of us and why we should all come to the table and demand a change, because remember, nationally it adds to the healthcare system over $220 billion a year. From no matter how you look at it, that's a significant amount of money. What does that mean? That is the same amount that smoking adds to the healthcare system. But we have a collective effort to reduce smoking and reduce the sequelae of smoking. But we do not have a collective effort to reduce racial differences in health and the healthcare system. They're the same.
These are issues that can be addressed. So these are things that we have the knowledge, we know how to do it. We just have to have the will to do it. We have to make the investment. It's going to cost some money, but it costs the society more when people are sick.
This will only change when the entire community says, As my mother would say, enough is enough and too much stinks. This is no longer acceptable that in this modern day, when we would like to tout ourselves as a free and just society, we would like to say that we are getting close to reaching what America has stood for in its founding: life, liberty, and the pursuit of happiness, freedom and justice and equality for all. You can't have life unless you have health, and you can't have health unless you have a healthcare system that is fair and equitable and free of discrimination. There is something wrong, and it's not a black problem, it's not a white problem, it's an American problem. And that problem is sickening, and again, enough is enough and too much stinks.